Good evening, everybody. ISVS is honored to welcome Dr. T.N.Ganesh, a good and personal friend of mine. Dr. T.N.Ganesh graduated from Madras Veterinary College in year 1978 and completed his doctoral studies in 1992. His forte is orthopedic surgery. He loves to do orthopedic surgery. He has undergone couple of trainings, AO fellowship training at Cambridge Veterinary School, UK in 1996, and again training in small animal orthopedics at College of Veterinary Medicine, Michigan State University, USA. On personal front, he used to visit Madras Institute of Orthopedics and Traumatology very early morning, and from there he used to reach Department of Surgery, Chennai. This speaks volumes about his dedication. Again, subsequently, he has undergone different roles during 1980 to 2015 as unit officer, small animal orthopedic unit, professor and head department of veterinary surgery and radiology, Chennai, Madras Veterinary College, Chennai, director of clinics again at MVSC, Chennai. And he has global exposure in field of teaching, surgery. Dr. Ganesh has worked in University of West Indies School of Veterinary Medicine in Trinidad and Tobago for 5 years. Again, he worked as senior lecturer in Addis Ababa University College of Veterinary Medicine and Agriculture. And again, he worked as professor of veterinary surgery from November 2016 to April 2017 at University Malaysia Kelantan. And he has worked as faculty of professor between May 2017 and December 2019 there. Since January 2020, he is again serving in the University of West Indies, Trinidad and Tobago. Dr. Ganesh has published 94 papers in peer-reviewed journals and mentored 17 masters and 1 PhD student. He has delivered number of lectures as invited guest speaker at different fora in various countries. A highly disciplined surgeon, and ISVS is truly honored to have Dr. T.N.Ganesh as speaker in today's seminar. The topic is of immense importance and demands dedicated efforts in clinical teaching from all our surgeons. Dr. T.N.Ganesh, please.
Thank you, Dr. Patil, for the introduction. Let me first thank the ISVS team. I'm glad that I am back with you. And also I thank INTAS team for arranging this wonderful webinar, also the previous webinar. I really enjoyed the initial presentation by INTAS. Wonderful. That shows that we have to drive towards the technology. Okay. I think it's time for me to share the screen.
Yes, yes.
Yes, sir.
Right. Hope everything is okay.
No, sir. Screen is not visible yet.
So you need to start sharing.
Is it okay now?
Yes.
Yes.
Thank you. Glad again to be with my colleagues in ISVS in India. And also I am glad that I am connected with my friends from other places other than India. So this presentation is very important, as it was already mentioned. And it's going to be like this: clinical teaching and learning veterinary surgery during COVID-19 pandemic, managing the challenges of virtual teaching, learning, and telemedicine. How we are going to go about? Right now, I am at Trinidad and Tobago, the University of the West Indies, very close to South American continent, Venezuela, and it's a twin island country. The larger island is Trinidad, and the smaller one is Tobago, just 7 miles off Venezuela, South America, and then we are 13,783 kilometers away from India. Thanks to technology, we are so well connected. Only time difference is the issue. And presently, I'm serving the University of the West Indies, St. Augustine campus at Trinidad and Tobago. It's a regional university. I am with the School of Veterinary Medicine, which is part of Faculty of Medical Sciences. So it's like One Health concept. And the Faculty of Medical Sciences, we have School of Medicine, School of Dentistry, School of Veterinary Medicine, School of Advanced Nursing, School of Pharmacy, and so on. And then if I don't speak about leatherback turtle sitting at Trinidad, I won't be doing justice. So as we know, the leatherback turtle is the largest turtle and endangered species. And Trinidad is one of the second largest nesting places. Means they say about 6,000 turtles reach Trinidad every year for nesting. So it's amazing to watch these animals nesting. I had an opportunity to volunteer and then work with that kind of studies too. And then I have to mention about scarlet ibis also, beautiful bird, and hundreds of birds returning to Trinidad for nesting in the evenings. It's wonderful to watch. The juvenile birds would be like gray, brownish in color. Once they become adult, they look so beautiful with scarlet ibis scarlet color. Okay, my talk would be on these lines. I would spend a few minutes on introduction, dealing with our experience here with regard to online teaching, etc. And then it goes on like how do we perform online teaching, online lectures, online assessment, and how do we manage virtual clinical teaching and training virtually, and what is expected from students for them to learn through online, and then a few slides on telemedicine, and then I would summarize and end with some points on how do we travel in future. And every slide I have mentioned at the bottom a footnote which says virtual teaching can only complement face-to-face clinical teaching. It's not a replacement for clinical teaching or training. So all we do virtually is going to help our students by way of complementing face-to-face or on-site teaching or training. So I am very specific about it. And then back to introduction. Again, the topics would be, I'll talk something about the background, the impact on the universities, education strategies for this academic year, teaching models, the new normal, and the way forward. Okay, as we all know that we are going through a very difficult or tough time as teachers in the university. And also I know that today's participants would be students, of course, maybe many of the postgraduate students in India doing surgery postgraduate program, and also practitioners, veterinarians who are qualified with masters and surgery qualification. The field vets are practicing vets. So everybody is facing the hardship due to COVID-19. So COVID-19 lockdown changed the classroom teaching into online teaching. Something like from lecturers' home to students' homes. In fact, from lecturers' kitchen at times to students' homes. Staff and students quickly learned the new normal way of teaching and learning. Teaching effected through various online platforms using different tools, all of us are experiencing. Virtual online sessions are being held through video conferencing with very active participation by students. The concept of learning sorry, are you able to visualize the slides, Dr.
Yes,
Bhatia?
sir. Yeah, yeah, yes.
Because I'm sort of I'm sorry about it. There is some interruption.
So if anything goes wrong, we'll tell you. Otherwise, all fine.
Okay. The concept of learning anytime, any place, and any device becoming a reality. I have some technical issues. Okay. So how these COVID-19 pandemic impacts all the universities? Modified teaching and learning methods are constantly being reviewed by the universities and institutions to improve educational delivery. The challenges faced by the lecturers, students are being addressed by institutions to the best possible way. And then continuous research on modified education delivery system is going on through feedback analysis, which happens everywhere, including my university. And then changes in curriculum delivery to align with accreditation of the program, because all the institutions are accredited by some agencies or organizations. So we should be also equally concerned that the programs are still valid and strong and accredited by concerned agencies. And then implementation of rigorous protocols at institutions. Keep the
1577-608.
Keep the people safe and then keep staff and students safe. You can see in the picture.
Single 6.
Vet school, every entry point, you see a lot of guidelines, instructions, and how everybody need to follow the COVID regulations. And then every entry point, there'll be sanitizers kept. So everything resulted in transformation in veterinary education, which is happening very rapidly due to this pandemic. So what's the plan for the academic year 2021? Naturally, all the universities are resorting to online teaching. The current health and safety protocols, which are rigid almost everywhere in every countries, which requires modifications in the course delivery. Universities are getting prepared to welcome the students virtually, very unique situation. And already some universities enrolled the students and then started welcoming them. Teaching through online mode totally, or blended or hybrid mode, unless we are prepared to provide face-to-face mode. So we have options: online mode, blended or hybrid mode, or face-to-face mode. Probably depending on the situation, every country, and depending on institutions, we may have to choose any one of these options. Modalities on offering programs and courses are being finalized, at the same time preserving the academic integrity. As academicians, we are so concerned that the program is still strong, whatever we do. Institutions continue to navigate the impact of COVID-19 pandemic so that we go strong. So the changes due to the COVID pandemic are inevitable and definitely required, but now it is on compulsion. So we have no other option. So we hear a lot about online teaching. Different terminologies are being used based on what we choose, starting from on-site, face-to-face teaching or training our students, particularly final year DVM or BVSC students, and then online method of teaching or online teaching, what we call. And then we use the term hybrid mode of teaching or blended teaching or blended learning, e-learning, virtual teaching, distance learning. Distance learning was one of the oldest or historic way of teaching and learning, started maybe 100 years before. And also flipped the classroom. We hear a lot about the advantage of flipped classroom. So what is new normal? We often say new normal. So we used to have normal. Now we are going through a new normal. I don't know what is going to be the future. The new normal, we are experiencing the new method of teaching and learning. We often expect the unexpected. There's a lot of uncertainty. What's going to happen the days to come? How we are going to manage? Because there are frequent changes happening in terms of the teaching requirements, the conditions around the universities and each country, the spreading of the disease, and so on. And then we also see some surprises. Many times, many of our colleagues have to work from home, including the students. And then that results in working odd hours, late evenings, early hours, or midnight. So we are prepared and we are experiencing to work anytime on compulsion again. And totally our lifestyle has changed. Everybody has to be wearing a mask when you get out of your home. And then we have to wear PPEs, personal protective equipments, and then a lot of talk about hand hygiene. So wherever we go, we get our temperature checked. When we enter the shopping center, or when we enter the institution, or when we enter the supermarket. So that's a new normal. So we are getting adjusted to it very quickly. So what's the way forward for us? So the COVID pandemic crisis forcing us to think outside the norms of teaching to enable the continuity, academic continuity. Tools are out there to enable teaching in virtual environment. So we have to choose the appropriate tools, and we have to manage and improve online teaching, particularly for our clinical students. And the use of primarily the university's online teaching platform. For us, we use My e-learning and Blackboard collaborate for teaching most of our program courses. And each university they have their own online teaching platforms, which is supposed to function good for them. And then examinations are being held online, whether it is synchronous or asynchronous. And we have to collate the information on various tools available for virtual teaching. And then we have to continue to improve the education delivery through periodic feedbacks from our students or colleagues. Always we feel that we have to include the students on decision making at different level, in the department level or in the school level or university level. So what is our experience at our university at UWI, School of Veterinary Medicine? We experienced a complete lockdown in the middle of March, and we stopped teaching totally just for 1 week. And then, except we were continuing the emergency and essential services in the clinic and at the school. In the meantime, within 1 week, all of our colleagues underwent training for online teaching and evaluation. And after 1 week, we resorted to online teaching. We also had a collaboration with other universities. To name one, University of Illinois at Urbana-Champaign, to share the experiences and then move forward. And apart from teaching through online, we were able to conduct evaluation, particularly the coursework evaluation through synchronous and proctored. But then the semester final examinations, particularly for the final year exit exams, we had a lot of challenges. So we had to choose asynchronous, non-proctored, take-home exam. Otherwise, simply an open book format. So it was a big challenge for our colleagues. How do we set exam for the students to answer the exam through open book format? So that was a great experience, but then we managed. And then we were back to business sometime during middle of June, when things are becoming normal. Right now, we are going through the academic continuity and started teaching online for this academic year. This is our experience in brief. The question is the shift to online teaching in COVID-19 environment a boon or bane? Let us see. Long before, sometime during 2010, a study was done in US Department of Education by a group of teachers, mainly in the schools, to find out how does the effectiveness of online teaching compared with face-to-face instruction. And does supplementing face-to-face instruction with online instruction really enhance the learning by the students? What practices are associated with more effective online learning by the students? What conditions influence the effectiveness of online learning? The result was, on average, the students in online learning conditions performed modestly better than those receiving face-to-face instruction. It was just a study, but then there are various experiences from different institutions. But then this is one of the studies which indicate the present generation of students are able to accept or receive this mode of teaching. And in fact, they are able to do well, but then we have to do further research and studies, particularly for veterinary medicine. We have different choices for online platforms. Many of us are quite familiar with at least few of the online platforms which are available, and many of us are probably using frequently. So in our institution, we use My E-Learning and Blackboard Collaborate, in short BBC. And then we are also using Zoom very often, both for teaching and for meetings. And we also tried Cisco WebEx. Some of our colleagues tried Cisco WebEx. I know in Malaysia, my colleagues in medical school, they use the Cisco WebEx successfully. And then we tried Socrative at one point of time. I and my colleagues tried Socrative to conduct in-course evaluation by using a combination of Socrative and Zoom, where the exam was conducted through Socrative for a small group of students. And then we were proctoring students writing the exam through Zoom. And then we have Google Meet. I had an opportunity to talk to students, my former students in Malaysia, reviewing the topics in final year small animal orthopedics through Google Meet. It worked very well. I also attended quite a few ward rounds or rotation rounds at Malaysian University through Google Meet. And then Moodle, Schoology, Responders, particularly for conducting exams. And then we hear a lot about podcast much earlier. And then recently I heard in the schools, primary schools, they were using MyCamu. So plenty of options are available. So we need physical social distancing through this pandemic. But at the same time, we also need a lot of virtual social contact to move forward. So the online lectures can be performed through real time, which is synchronous. When we say real time synchronous, what is the ideal duration? Usually we lecture for about 50 minutes and then leave 10 minutes for question and answer session. Unless we have to continue, we give a break. But then collaborating or discussing with colleagues, particularly one of the professors in US, he mentioned that ideal duration for online lectures should be not more than 20 minutes. So again, we are working on how best these modalities function well for teaching and learning. Other option is recorded lectures, which are asynchronous. There are benefits or different views are there using asynchronous way of teaching students. And then creating discussion forums, and then group work. So we have several options. But then remember, we have to use during our lecture presentation, adding several pictures and videos so that the students are able to grasp or understand, because you are teaching through online. My experience teaching through online, I would say the saddest part of my 40 years teaching was sometime in late March this year, when I taught the DVM3 students through online without seeing them. So that was very unfortunate. But then we have to learn how to manage. So we learn about flipped classroom, how it is more effective than traditional classroom teaching. The advantage of flipped classroom, we can learn more about it. And in fact, we practice, and many of us practice this, the strength of flipped classroom method of teaching students. The method of online lecturing, as lecturers, we are trying to not formally trained, but then we are experienced in teaching students in veterinary program in whatever way possible in an effective manner. But for online lecturing, we have to choose appropriate platform so that it will suit the lecturer as well as the students. There is no single online platform which is the best. Use of appropriate presentations. So whatever PowerPoint or whatever presentations method you choose, it should be appropriate for, particularly for online lecturing format. And choose the ideal duration which is best for you and your students. And effectively use the chat options and other interactive options available in each platform. And spend sufficient time for question and answer session. And you have to be prepared for online teaching, particularly for online teaching. The preparedness, both by the teacher and the students, are very essential. Many of the universities assist students, particularly in the early stage of COVID pandemic, when students are away from the universities, or some of the students are really in remote, so without a proper support. So the universities try to help such students by offering some devices, laptops or other devices through loan. Smartphone usage became very popular for teaching and learning. And then also some mobile phone service providers were happily helping students by providing free internet to students during lockdown period. So these are some of the support systems for the students during the COVID pandemic, in particular during lockdown period. So we have several options to assist our students for learning the best possible way. Coming to assessment. So when we do teaching, it's equally we are responsible to assess the students how they learn, and then to move forward we have to conduct exams, and then the semester need to end, and then things have to follow with. So the options are splitting the assessments, such as the take-home assignments combined with timed online quizzes, or short answer or essay type questions through whatever online platform you are familiar with. If online proctoring considered, that means when the students are writing the exam, you are observing or watching the student writing the exam, then you have to specifically allocate certain percentage of marks for take-home exam also. So it is how best you provide the percentage of marks for online exam or take-home exam and other maybe face-to-face oral exams and so on. But whenever you conduct exam through online, it is very important that you have to make the students to submit their exam, in particular the essay type or short answers, through Turnitin, for us to identify how much plagiarism possibly the students have performed, and then try to evaluate students in a fair manner. So students, unfortunately, some of them just simply copy paste, so that's not acceptable. So you have to make sure that the examination system is rigid for us to evaluate the students uniformly or across. And we also use modified ASCII. So ASCII exams are normally conducted on site, but then we use modified ASCII through online, where we project questions through slides and then make the students to answer, and simultaneously we proctor them through other means of online platform. There are a lot of talk about authentic assessment. So ideal assessment would be one that not only assesses the students' learning, it also teaches students and improve their skills and understanding of the course content. So the fundamental aspect of such assessment is that they are authentic. That means practically how knowledgeable they are. So probably you provide a case scenario and then conduct exam from that source. So that's kind of authentic assessment. You can try to learn more about authentic assessment. What are the assessment platforms available? Again, we have various online platforms available for assessment. Plenty are there for you to choose. Okay, coming to teaching clinical skills, that's a major issue for us. I just go through this because each word is important. Although it is a challenge to provide practical exposure and hands-on training in subjects like veterinary surgery, it throws an opportunity for the teachers and trainers to upskill in digital competence and to develop suitable digital contents using a variety of formats such as interactive modules, recorded videos, and virtual stimulation, and embrace the new way of teaching and learning. Okay, how do we actually conduct the online rotation, or what we call clerkships? The ward different rotations or wards or clerkship. What we do is we start with online orientation for the final year students or new final year students, and then we try to engage them by conducting daily rounds. The clinicians are working in the clinic, but the students are at home. So we, instead of students presenting cases, we, the staff members, we present cases and then make the students to interact in such a way they learn the cases, what is being handled at the clinic right now. So they are aware of what's happening or what's going on in the clinic, what type of cases we see here, how we manage, and so on. So this can be through online. So we do case rounds, and also we do topic rounds. We choose a topic and then we rotate among ourselves to conduct topic rounds for the students. Maybe students also can be assigned topics for them to conduct topic rounds, or the students can be asked to conduct rounds or present cases on whatever cases they have seen recently in their externship or elsewhere during this COVID period. Probably some students go to nearby practice or clinic or dispensary or hospital, and then they learn from cases. And it's most important, it is possible that we can perform an interactive live streaming of the consults, what we do in the clinic, whatever procedures you performed in the clinic, also the surgical procedures. And then we can also provide them a take-home assignment every day for them to work. And then on-site, normally we display case of the week and X-ray of the week, what is your fracture plan, and so on. So all these options are possible through online. So recently when I was Googling, I found that the University of Florida College of Veterinary Medicine, during March, they launched a cooperative, or groups of academicians joined together to generate online clinical based rounds for shared use. So helping each other. So they named it as Veterinary Isolated Clinical Education, otherwise WISE. So that worked well for them, and then it is being adopted. Many academicians in the US and UK and few from Canada joined, and then they developed this WISE and then started sharing their cases through online for the benefit of students, not only students, but other colleagues. But again, we have to constantly remember there is no substitute for experiential learning. Moving on, what about live stream of surgery? So how do we make students to learn surgery? The best option is use of GoPro camera with a handset or headset at operating room or clinic or ambulatory site when the staff members are outside in the farm treating farm animals or other animals. And so the GoPro camera can be connected to Wi-Fi, and then you can perform a live stream from the operating room. For the students to watch surgery in real time, as if they're all with you, around you in the operating room at the clinic. So it's commonly used in some of the US universities, and my friends they use, so they shared me some pictures. Also they shared me with some videos I'm unable to share with you right now. But then plenty of YouTube videos are available on this for you guys to check on your own. It's one of the best option for teaching surgery at this point of time. Even though the students cannot learn their skills, but then they can learn various surgeries, procedures through online. So it's not very expensive. About the price is maybe you can choose GoPro Hero model 7 or 8 black, which would be about nearly $400 US, but then they give a discount, it comes to about $300 US. So hopefully it will be a very effective teaching tool for teaching our students, particularly veterinary surgery. So how do we manage functioning at the clinic floor at this point of time? We can work in small groups. When students are available on site, they can be divided into small groups to minimize the number. And then everybody has to wear PPEs. In addition to mask, we prefer the face shield at times because of very closer interaction. And then in the clinic, every clinic, we have to do a triage to find out what type of patients we are receiving, how to prioritize. So before we fix an appointment or we receive patients, we have to have a dedicated, probably intern to perform the triage, and then mostly history taking and with social distancing or from remote through video conferencing, we try to do history taking. Probably students can be allowed to do history taking from remote instead of being closer with the clients. So, and then students can stay, if possible, and involve in all the procedures if they are available in small numbers. And then we can also make students to stay in the clinic at a minimal period and then rotate the group of students, particularly to learn the competencies. Otherwise, other part of teaching can be done online. So all the clinical teachings are possible, and interactions are possible, and discussions are also possible through online. Recently, we operated a turtle. We had to amputate the flipper. So when we have to handle the patient or treat, at least few of us need to be there to handle the animal, to feed the animal, and so on. So we have to maintain possibly social distance. Otherwise, we have to have appropriate PPEs. Further, we need to have facilities like infrared thermometers, appropriate wash stations everywhere, sanitizers, masks, face shield, trying to follow social distancing wherever possible. It's very difficult in a clinic work style, and then allowing minimal number of persons. And you see one of my colleague, apart from wearing a mask, she's wearing a face shield because people have to interact very closely. The protocol at the clinic, as mentioned, you have to do triage, and then we prioritize emergency visits and procedures until regular business operations resume in the community. And most of the elective procedures are slowed down or delayed. And we try to do a curbside service at the car park. And then we use telemedicine, which are effective options to support patient care with social distancing. And we try to restrict the number of personnel into the clinic or practice. That's very, very essential. Some of the risk control and mitigation measures, starting from PPEs, social distancing, hand washing and sanitation, infrared thermometers, and rostering of staff as well as students. So every point of entry, we have to have directions and guidelines for everyone to follow to prevent spread of COVID. So what about online learning? For students, they have to unfortunately learn everything through online. Online learning has historic roots in the tradition of distance learning. As I said, maybe 100 years old method of online learning. The distance education programs started when internet and the World Wide Web facilities were available. Very easy to reach learners all around the world. So it became much more popular. Today's online learning offers very rich educational resources in multiple media, capability to support both real-time and asynchronous communication between instructors and learners. Institutions, however, institutions of higher education like universities and corporate trainings quickly adapted this online learning and training options. So students have to adapt to self-directed learning. So we often say mother, father, teacher, and God. Now it has become mother, father, Google, and God. We are also try to consult our peers, seniors, and teachers, but then a lot to be learned through self-directed learning by choosing appropriate source to complement the traditional method of learning. The students have to adapt to the self-directed learning through problem-based learning, case-based learning, team-based learning, and small group learning. So everything is getting shifted from the focus of teaching to learning. So it's very important for students to adapt to self-directed learning, whether it is undergraduate or postgraduate students. So at the midst of pandemic, what is the students' responsibility? Everyone is learning together, including the lecturers. They try to find the best way to impart teaching and skills to help students to improve their knowledge base. In the midst of pandemic, students should take the opportunity to make most of the opportunities offered. Opportunity to strive during difficult situations, how the students can manage such situation. Opportunities for a greater amount of self-directed learning, a skill that is very useful during the career as veterinarian at a later period. So they have to use it as an opportunity. And examples are learning surgery by constantly or frequently observing the surgical procedures repeatedly and several times before they practice. And great opportunity to improve communication skills through online mode of learning. Opportunity to improve critical analysis skills. Opportunity to see actually the public health perspective during this COVID time. The students, veterinary students, get an opportunity to understand the reality of public health. So how do they learn? Possibilities of students to learn at remote from home. Some of the basic skills, suturing and knotting skills on models like Daisy can be possible at home when they get a loan of these Daisy models from the school. And they can also use their own animals or their pets as patients for learning some of the basic clinical skills and also advanced clinical skills, orthopedic or neurological examination and conducting the tests. And they probably can try with their own family members as clients and practice history taking and learn communication skills. And other option would be they can always visit to nearby universities or any accredited university accredited government private hospitals or practices in the neighborhood for them to continue to learn the knowledge and skills even though they are away from the university. So there are several options for the students to learn the skills even though they are away from the teaching institution. So ultimately, we expect students, particularly the surgery students, to learn the day one clinical competencies, which are basically in our school. Few of the clinical competencies are laceration repair, simple lumpectomy, and then hematoma drainage, oral hematoma drainage, castration and spaying. So vet schools are considered the gatekeepers for the veterinary profession in terms of making students learn day one clinical competencies. So in order to graduate, students must have achieved all the day one clinical competencies that are required for practice as a newly qualified veterinarian. They have to strive. So what happens during pandemic? The challenge for learning day one clinical competencies, particularly the clinical competencies which we are interested in surgical skills, the skills in anesthesiology and diagnostic imaging. As a team, we have to work, the teachers and students, to accomplish this possible learning of day one clinical skills or competencies by making adjustments. But then it's not possible in every case. So in an impossible scenario, when our students are not able to get all the day one clinical competencies, we don't want to compromise, but then there may be some exceptions, maybe few students or one or students would not have been in a position to learn maybe one or two clinical competencies. Then the graduating student should learn the few leftover basic skills outside of the institution very responsibly and with passion before practicing. So we insist that because not all competencies are learned by graduating students. We learn a lot, several competencies after we graduate. But then the basic day one clinical competencies, they have to learn at the school. If they miss, it's their responsibility to learn before they practice. That's what I advise. Okay, what are the challenges in online teaching and learning? Non-availability of appropriate digital tools, which are very common, particularly in probably some of the countries which are so-called developing countries, or it's a reality that not all the students are privileged to have the fine computers or a good internet support and so on. So also the staff and students, probably they lack appropriate training for online teaching and learning. So it's very important that we have to get trained properly before we adapt these techniques. Very poor internet or Wi-Fi support services occurs in some places, unfortunately. So we have to consider that. And non-conducive environment, which is very, very important for both for the lecturer and the student. We try to teach from an appropriate place so that the teachers are not distracted, and it is actually conveys the required knowledge. The environment can seriously affect the teaching by the teacher as well as the students to learn. It should be very quiet atmosphere, and then no disturbance and so on, particularly at home. And then the major problem we face also the students' intense exposure to screens. Last 1 week I have severe irritation in my eyes because that's what happening for everyone. So we have to frequently use one of the screens, so we have to take care. And then financial issues, particularly our students, the financial issues are major during this COVID pandemic. For them to continue to be in academics, it affects students' enrollment, it affects functioning of the university in a serious manner. So we have to find ways to manage this. And the final and important issue or challenge is the psychological and mental challenges both the staff members and students face during this COVID pandemic for teaching and learning. So we can talk a lot about all these things, but then remember how best we can address these things so that we continue to travel in the journey of education and learning. So if we have a passion, definitely we can keep going on our profession of education, educating the students. So just few more slides. Telemedicine, at this point of pandemic, telemedicine is one of the major tools for teaching and learning. Veterinarians offer healthcare remotely through video conferencing, otherwise virtual visits and telemedicine. But we have to make sure or ensure delivery of the desired treatment in a proper way, that the communication with clients. The recordings are to be properly entered in medical records for future reference. Everything needs to be recorded appropriately when you follow a telemedicine concept. And it is possible for our colleagues in the practice or colleagues in the field to share their cases as a referring vet to the university teaching hospitals for the purpose of teaching students. So they play a great role. The colleagues who are in practice or in the field now attending this webinar, I request them to share the cases with your colleagues in the academics for the purpose of teaching students apart from mutual assistance for treating the patient. And telemedicine to support clients, referring vets and students. During the pandemic, telemedicine plays a major role, not only to assist the lecturers, but also to our clients, the veterinarians, referring veterinarian, and also the students. Telemedicine is a very good teaching and learning model, and there are mechanisms to familiarize telemedicine. So we have to learn it, make it more effective. But then we have to remember the ethical and legal issues. So when we use a telemedicine, a vet at remote is guiding or giving consultancy to the referring vet. So who is responsible for the patient? Is the patient, the vet who is treating the patient, or the vet who is at remote offering the advice or guidance? Is he responsible? So we have a lot of, there are a lot of ethical and legal issues involved. So we have to formalize. And the point is we have to train the vets for telemedicine, both in academics and in the field. And we also have to train students on telemedicine. And then we have to expand the scope of telemedicine and also possibly incorporate in curriculum, because it's going to be the future. I do get a lot of requests from my friends in the field in India, my classmates, sharing the cases and then request for some suggestions. Just before starting the webinar, 15 minutes before starting the webinar, I received a message from one of my classmates in a small town in Tamil Nadu. He sent a picture of a patient, a cow. I'm showing to you. So just at 6:18 a.m., I started at 6:30, just 15 minutes before. He stated the cow calved 6 months back, not pregnant. From today morning, the neck is twisted like this. If straightened, after a few seconds, again it twists like this. No pyrexia, poor intake, looks dull. Line of treatment, please. This friend, very frequently, he will send information about the patients he is dealing with and then request me. And then if I know, I'll share my views or I'll consult my friends across everywhere. And then instantly I provide the suggestions. So the point is that telemedicine is going to be the future. So let us try to make best use of it. The other important thing which I would like to just mention, the spatial computing, which incorporates both virtual reality and augmented reality. Collectively, it's a mixed reality, which is rapidly moving from the realms of science fiction into fact, providing those in healthcare with exciting and interesting new tools for everything from collaboration to education and training. So a lot of scope for education and training using virtual reality. Its use remains, unfortunately, its use remains in infancy in veterinary medicine, but then it's commonly used in human medicine because of the cost factor. Still, it's not so popular in veterinary medicine. If you Google and if you go to YouTube, you can see a lot of interesting information about virtual reality being used for teaching and training. Please do that. So moving forward, so as educators, a saying goes, make your work count twice. The first time for the job you are doing, and the second to get the work published and disseminated. So that means you have to constantly analyze what you are doing, apart from online teaching or whatever best you do for the help of for helping the students. But you have to analyze or research what exactly you are doing and try to improve the curriculum delivery. So you have two responsibilities. Again, there is a saying, at the end of the day, we try to remember that education begins with one teacher and one student. But then we are trying to do our best. Okay, to summarize, to mitigate the COVID-19 challenges, we need to have a very close partnership between institutions, the local, also global. And also we have to collaborate with academics who are within the institution and outside the institution. And in terms of sharing the ideas and sharing the teaching aids and tools and sharing the concepts and sharing the experiences and so on. Similarly, the students need to collaborate among themselves, either within the institution or outside. And we do get a lot of suggestions from students too. So we try to use their suggestions and views so that it benefits mutually. Do all possible uh, methods of education through online and online to complement without compromising the basic clinical and surgical skills training. We try to do our best not to compromise. And there is a time to do more. It's time to do more towards educating our students and try to do what is best for you and what is best for your students with your own experience, with your students' experience. So what is the future? Future is going to be virtual teaching to supplement or complement clinical teaching and training to get accustomed to the new normal so that we quickly move on to teaching our students. And we need to be prepared for future challenges, if anything more going to come about. And then we have to equip with suitable teaching and learning devices, example, digital tools, the models, virtual simulators, etc., which may be expensive right now for veterinary education, but then soon we are going to use them. And then it's very important to modify the curriculum for effective delivery of the education at this point of time and in future. And then we should also learn more about the Industrial Revolution 4.0, what it implies to education. Particularly, there's a lot of talk about virtual reality, a lot of information on artificial intelligence. And then we have to align with the needs of industry, what the industry needs the graduates to know. So accordingly, our program should deliver. So that's going to be the future. And so we should remember that just beyond merely surviving this pandemic, but we also thrive to do the best. So when the whole world is moving ahead, as academicians in a particular institution, it's not wise to lag behind. So we have to think out of box and then do what is best possible in your own department or institution, and then help our students. Because students are our customers, apart from clients and referring vets. So it's our duty, as Mahatma Gandhi quoted, it's our duty to serve them in the best possible way so that we have a very good relationship with students, our clients, and also referring vets. Presently, we are moving through a difficult road, but we know that it always leads to beautiful destinations. When I included that this slide, I remembered my journey twice to Mukteshwar. The travel to Mukteshwar was so difficult, but then once you reach Mukteshwar in UP, in India, so beautiful. So we have to remember that right now we are passing through a difficult period or difficult road, but in ahead, we know there is a beautiful destination. Let us be prepared for that, be patient, and definitely we will perceive. Thank you very much. I know all of us are seeing light at the end of the tunnel, and we are sure as educators for the present generation of students who are going to be the future pillars of the profession would benefit from all of us. Thank you very much, both ISVS team and INTAS team. Thank you again.
Thank you, sir, for a insight into the pandemic, what we are, and where we are going to lead us for a better tomorrow. And the closing note, which talks about your journey to Mukteshwar. I thought you'll be talking about Ooty or something, but you went to the north and talked about the north. So great of that. Uh, Sir, questions as the subject is different are a few. The first and the basic question comes in is how are we going to deal with practicals on a virtual screen? Practical learning.
To be frank, I don't know. Not everybody knows how to
Yes.
deal with practicals. Okay, what we plan as educator, what we plan right now, when the students are not here with us at the campus, all possible we try to do conduct practical by means of showing, preparing the students for practicals by interacting with them, what is expected out of them while doing practical. Maybe we can do a demo and then live stream students on practicals, what they are going to do or what they are expected to do. And we can document the practical sessions in the form of videos, and then we can share with them. So they can repeatedly go through that and then try to learn. But nothing like for them to learn on their own at the school. But it is also possible for students to learn some practical aspects at home, as I mentioned. Some of the things like examining clinical examination of a patient at home, palpation of the abdomen on their own dogs, or maybe a cow at the backyard. They can examine the animal and learn the practical aspects. And we try to delay the practical sessions at the later part of the semester. So we timetable in such a way that we try to cover all the theory teaching or didactic lectures or discussions and interactions, even some exams. But then we try to keep practicals at the later part of the year or the later part of the semesters when the students are available on site. But also depending on the country, depending on the institution, wherever possible, we can try to bring in the students in small numbers. May not be possible to bring the students, the whole class for practical. We can bring them in small numbers and then rotate them if it is possible, and then conduct the practicals. Lot of issues in organizing these things. So it's left to you. If there are some other means or ways, I'll be very happy to learn from you too. So share with everyone. Thank you for that nice question.
Yeah, true, sir. What we have been observing, sir, during this webinar is that 30 to 40% of strength is UG students.
Yes.
As such, they are not getting either they have only an online course as one of the source of education, or some colleges are still not having that regularly. So of course for vets we have e-courses also on, but in these e-courses these UG students are not allowed, saying that graduate is must. So what I'll request the entire academic field is that probably you can organize some training course or e-course for these students in particular, wherein the students of entire 4th year or 5th year or whichever year, depending on the subject, can come down and be a part of it. Could be one possible option of helping
Exactly.
students. Yeah.
Exactly.
I understand that institutes like Tanvas and all are fully doing online classes, and it's very good, well synchronized, because you have 3-4 colleges. So the surgery of 411 is going on for the entire university. So pretty fine. But there are colleges where there are universities where there is only one college. So that makes where people are getting held up. So
that's what I was about to say. It's the responsibility of the individual universities, and they have to offer what is possible, and they have to collaborate among themselves for the benefit of students across. Thank you.
Thank you, sir. The next question is very appropriate question. It says, do you feel that virtual screen is better or chalk and board is better? So I think Dr. Ganesh said in the very starting that the classroom teaching, the live teaching is one of the best teachings, and this can not replace that, can only supplement that. He said it in the first point itself. So that question doesn't need to be posed to him, but that is the way people have asked, sir. And
Yeah, but blackboard teaching still we do, even in the what do we call the classrooms or well equipped classrooms, still we have blackboards. So depending on the teachers, we use, apart from PowerPoint presentation on the screen, we also use the blackboard. I still use the blackboard for additional information. But then ideal would be face-to-face teaching, because we are seeing the students, and teaching is the best way of teaching rather than without seeing students. Something like I compare the movie actors, the cine actors acting in outside the studio. What do we call in the field, or outside the studio, they act in front of so many people, but then they have to imagine there is nobody is in front, and then they have to act. Similar to that, as a teacher, no students are there in front of me, but then I have to imagine the student, all the class students are there in front of me, and then I have to act accordingly. So that's like that.
what sir is saying is very true, that once we start teaching our students on a virtual screen, we feel that we are talking to a computer, and it takes time for each and every teacher also to get adapted to that. Is a true feel. Correct. Which is coming from an academician. Thank you, sir. We thank you on behalf of the entire ISVS.
Sorry to interrupt, but I am sure the present teachers, particularly the younger generation, will definitely do much better than what we are capable of doing. So I'm sure that things are going to be very good for our profession.
Sir, I think the whole profession has taken only April or mid of May to get adapted to it, and currently we are well utilizing the virtual screen. I think Dr. Patil has got something to say.
Dr. Bhatia, I have one question for Dr. Ganesh. Like, virtual training gives false sense of security to students at times. It's a thin line. This sometimes may be, like in a clinical practice, sometimes hazardous.
Exactly. That's why I mentioned that everybody should be responsible. We have responsibility as a teacher to teach. Okay. The students have a great responsibility to learn and then practice. I would say in this regard, the students have much more responsibilities than teachers, particularly when they are learning through online. When they practice, they should be much more responsible. Thank you for that question.
Thank you. I think this was very much required, and all universities will gain from your presentation, and they'll try to bend their back and implement your suggestions, and it is for the good of the students. Thank you, Dr. Ganesh.
Welcome.
Thank you, sir, on behalf of the entire ISVS, the president, and the entire group, and the entire audience for being there. Actually, all these last 4 months we were saying canine, bovine, this topic, that topic, speaker from north, south. It's good that you have brought in a COVID orientation and an orientation which is required. Thank you, sir. Thank you.
Thank you very much. Thank you.
Thank you to all. Thank you.
Thank you.
Again, I thank you, the ISVS team and INTAS team. I'm unable to mention names right at this time, no time, but I thank you all profusely. I hope the webinar would make people to think more, and then we can continue to dialogue, and then come out with good ideas and suggestions for our own benefit of teaching students and the profession to grow. Thank you very much.
Thank you, sir. Thank you. Yeah, good day. Thank you.